of the things I find really impactful, that a change that I made in my own school nurse practice, is to make sure that I was visible, both inside of my health office, which clearly we have to be, but also outside, being in the walls of the school, being outside of the walls of the school. So being in places like hallways, lunchrooms, anywhere where transitions are going on, where things are happening, that's a really important place for school nurses to be. I also started doing rounds. Think of it like a moving shift report. We all have those kids, right, that we know we're going to see every day, or those teachers who are always sending those kids that we know we're going to see every day. So what I decided to do as an experiment was to go into those classrooms on a regular basis, first thing in the morning, to try to, limit how much non-instructional time kids were getting because they were coming to see me during instructional time. And that made a really big difference. I think teachers and staff and kids appreciated the visit, the collegiality, and answering any questions. Certainly COVID is a whole nother level of communication and challenges, but this was a pre-COVID world. School nurses have a wealth of expertise to share with the school community. And one way we can do it is in writing. We can do it, we can write blogs. We can make sure that we're present on the school website. There's many school nurses that don't even have a space on their school's website, let alone their district website. So think about the ways that you can communicate with your school community that speaks to your own talents and gifts and things that you like to do. So for example, I love to blog. So I've made that part of how I communicate with my school community. I happen to have multiple buildings, so that kind of adds to it. I'll write different updates depending on what's happening in each building. And so it's another way for the school community to begin to understand the scope of the role of the school nurse, because we do function as the chief wellness officer of the school. So certainly educating our school staff, our parents, and teachers and administrators and boards of education about what we do, in the end, really changes how we are seen. Let's tell them what we do rather than them decide what we do. I do believe it's important to be present at Board of Education meetings. They're very community-based. Sometimes they're a little contentious, but it's important to see what's happening in the community. Does the community support what the school nurses are doing? If you're not present, they don't know you. They don't know what you do and who you are. So this is another way to make yourself present. The other thing is not just to attend, ask to speak. Let them know. Be the one to say, this is what's happening at school. These are the themes that I'm seeing. Did you know that we are seeing, let's say, a preponderance of kids, I'm trying to think of one recently, that there's a lot of concern around, let's say, vaping in children. Certainly with COVID, there's many, many things to discuss. But when you see trends that you are concerned about, or when you want to actually promote an initiative that you're working on, what a better platform than to tell the Board of Education. They love good news stories. And a lot of times these boards of education meetings, not only are they taped, but they're televised, and there's other people watching, and they could pick up on one of the things that you're doing that you didn't even realize was newsworthy, because we don't spend enough time educating people about what we do, and it could end up as a very good news story for you. There's so many school nurses who have a difficult time transitioning from, let's say, an acute care setting to a school. And one of the biggest transition barriers that they come across is that they feel very isolated in comparison to working on a team in a hospital, let's say. At a school, you really are the only person. You're typically working in isolation, working alone. You may have, if you're lucky, you may have a health aide in your office, but you may not. And so finding your work community, your school community outside of your building is really important, because you need to have that network of colleagues to contact. The other thing is, we have to be lifelong learners. Policies change constantly. Just look at the coronavirus as a perfect example. Imagine if you were not really keeping up through your local, state, and national organizations. How would you know all of the changes that were taking place, which happen frequently? I mean, the CDC just changed their guidelines around quarantining. Things are changing at a rapid pace, and school nurses, like I said earlier, have to be lifelong learners. And it's our state organizations, it's our county organizations, it's our national organizations. First of all, they provide really good high-level professional development. If you're a member, typically they are low cost or free. And they also provide the funding around cutting-edge research. You know, if you join the National Association of School Nurses, you have access to 2 research-based journals that are published constantly from your own colleagues and sharing the work that they're doing. So it's really a way to stay on top of your practice and understand what's coming down the road, understand the legislative challenges that are happening, how you can get involved. And it creates a sense of community that we may not always feel, in our own school health office, because of you're really working mostly alone. Community and school are symbiotic. They really are. School is not separate from community. And what happens in and around the community 100% impacts school. So when I say embed yourself in your community, not every school nurse lives in the community that they serve. Sometimes that's actually good, because sometimes it's good to have a little distance from what's happening if you're especially in a small town. But when you understand what's happening in your school in the community in which your school is, you have a better understanding of some of the issues that you see in the school building. So it's true. I said, be present inside your school office and outside your school office, but also be active in your school community. So I gave an example. I was finding, and this is very common in school nursing, I was sending students home sick from school, and parents were immediately going to the emergency room for non-emergent reasons. Immediately. It wasn't even an attempt to contact their doctor. And I really wanted to find out why. It was happening over and over again. It was a huge number of people, and there just wasn't good continuity of care because they were just going to the ER. And I was part of this Johnson & Johnson School Health Leadership Program, so I needed an initiative to bring back to my community. And I was endlessly curious what was it about the relationship with their healthcare provider that wasn't working? What was happening? So we convened a series of what's called a community cafe, which is an evidence-based initiative. It's based on the World Cafe model, and it is a way to increase parent engagement or community engagement, because you are asking the community to provide, first of all, what they feel the issues are. We are not telling them, we are actually asking them, which should not be like a novel idea, should it? The community, they are the experts in their children's lives. Often though, decision makers up here do not include people who are actually impacted by the decisions that are made. So we've had, for quite a few years now, a series of conversations. They started out about how families were, what decisions, really, what questions they asked themselves, or what did they need to decide to go to the emergency versus go to their physician, to go to their pediatrician. What was it? Like, at what point would they change their decision? And what their experience was like. Was that part of the driving reason behind not going to their pediatrician? And some of the things we found were shocking. One of the providers required that the families come face to face just to make an appointment. and required it not because it was a mandated thing, but it's the function of how their office was not friendly and was not answering the phone, and nobody could get an appointment. It made people go in person. So it was a series of information like that. Like one dad said to me, I really don't like to go to the emergency room for things that aren't emergencies. But when I try to get my son into the pediatrician that I know works well with my family, and they won't let me see him because we're in a clinic and I get who I get, to me, what's the difference between that and going to the emergency room? I'm seeing a stranger anyway. And I think that of all the stories I heard through all of these community cafes, that one really stays with me, because, families are looking for a provider that they trust, that they can connect with, that they can have these either, these deep conversations with, or these scary conversations with, or these embarrassing conversations with. And so, I thought his point was excellent. Now, on the flip side, when we brought the information to the providers, which we did, this was over a period of time, they told us, interestingly enough, that our families had almost a 40% no-show rate. So 40% of the time that they had appointments, they wouldn't come. So then we got into this whole discussion about, do parents know that they need to cancel? Is that part of the culture of the office? Or is it just assumed that people need to cancel? How about if they're new immigrants and they don't know the customs of that particular office? I mean, a lot of really interesting issues were raised to deepen understanding of who is in your community and what do they need. If your school district is lucky enough to have a nurse in every building, I hope they are, because 25% of schools do not. And 35% of schools only have a part-time school nurse. It's harder to have this kind of meaningful, sustainable relationship, not just for the school nurse, but also for the parents and the staff. And having somebody there every day, having that medical health expert in a school building, especially in a time like COVID, where there's so much confusion around public health messaging and mitigation strategies and mask wearing and vaccine distribution. I mean, there's so many reasons that the school nurse profile has been so highly elevated and focused on during this time. But these issues are not new. In school nursing, in fact, it was a school nurse in 2009 that identified H1N1. She saw a trend in her school. Her kids had gone out of the country on a trip, and when they came back, she saw a trend of high fevers of unknown origin and brought it to the attention of the health department, and that was the beginning of H1N1 in the United States. So, the message around school nursing is that we as school nurses have to do a better job of explaining the scope and the magnitude of our role and our impact. We have not done as good a job as we can. And sometimes it's because people feel like it's boasting. I don't like to talk about myself. I like to, I do my work and I don't want to be the center of attention. And I always say to them, you are educating people. You are telling people what we do. If you don't do that, then, it's not understood. And therefore the value of why they need to have you there is diminished. So to me, one of the most important things we can do is to share our work, the scope of our work, the importance, the impact, the outcomes presently and down the road, because you just never know the work that you're doing now, what it means years from now when a student comes back to you or writes to you or connects with you. So it's a little bit of an intangible, but I think it's a very important idea to talk about. And I think we also have to acknowledge that school nurses have a hard time sometimes talking about their successes. They feel like it's boasting. And I'd love to change the culture around that, because it's not boasting, it's educating.